Inequalities and Innovation 21st Century. My focus is on upstream stuff. If you are not interested in pharmaceutical innovation, at some point in your life you will be. This is a room in which I normally teach MBA students. The difference between MBA students and you is I like you. Quickly thank the funders. Okay, I'm just going to talk about biopharma and its financing. I'm not assuming that drugs are the best approach to health, and I'm not assuming that finance reform is the best approach to the problems that are going on in the pharmaceutical industry. So it's very, very upstream, and the key takeaway message is the old model in which biotech was going to come along and displace drugs is not the case. And there is a more interesting model emerging in which large pharmaceuticals are turning into Toyota and having a much more sophisticated supply chain of small biotech, and then that is going to change the relationship between the private sector and the public sector. Okay, so background is a paper, The Myth of the Biotech Revolution. So there was lots of talk 10 years ago that biotech was going to transform everything. This paper actually looked at the evidence and said it's a bit more complicated. It's a very successful paper, that one. And you can see in data, this is UK data, that the number of biotech firms has kind of plateaued out. So there hasn't been this explosion. The last bits of data here probably are kind of constraints on the quality of the data we have, but it's basically a plateau, so it's not the explosion we were originally told. One of the reasons for that is that biotech firms are very, very difficult to finance, and it's very expensive. So this is a kind of an averaging out from a sample of UK firms, and you see that kind of over a 10-year period you've got to bring in 40, 50 million quid. This is averaging for a firm producing one drug, so it will be even more for other firms. The money coming in compared to the money going out is very, very close indeed. So the red line is basically how much cash they have in the bank on average. This number, 0, is very, very worrying. So biotech is not an easy industry to raise lots of money in, and it is not an easy industry to operate in if you like having lots and lots of cash in the bank. And these are the successes, the survival bias here. Okay, issue is this slide here. If you're going to get equity investment, not all your money will come in the form of equity. If you're going to get professional equity investment, then your investors will be looking, given the risks, at about a 50% PA increase. Okay? So that increases exponentially. So while the amount of money that you have to bring in is actually quite small, in relative terms, the amount of money you have to pay back very quickly becomes huge. So very quickly it becomes economically unviable to develop drugs. So this is the kind of averaging out. So if you are successful at developing a drug, on the technical terms, it does not follow that you will be economically successful if you can't pay back your investors the investment returns that they need. So example here, if you sell a £90 million company with a PE1 drug, in year 6 you're going to make 15 million quid. A year later you're going to make 11 million loss. If you take it further and go to a P2 and you sell that for 200 million, you'll make 45 million in year 8, but you'll make just under £250 million loss if you wait till year 11. Okay? So the economics of this industry are driven by that graph. It is very, very difficult to make money, and it is impossible to make money if you wait a long time. Okay. So the realization that this is difficult has changed the financing of this industry. What this very complicated and annoying diagram shows is how the various firms through time have sourced money. So the various routes they have taken. The interesting thing I think to highlight here is the importance of venture capital, the growing importance of acquisitions, and a huge increase in alternative sources of financing. So these are funding biotech firms rather than the traditional angel VC stock market, realizing that that is becoming very, very difficult, and you're moving to alternative and perhaps more interesting forms of financing. Other interesting thing is quite a successful industry, very, very small numbers of failures. Okay, so where are they getting their money from and what's going on here? First point to look from this graph is there is increasing numbers of financing rounds going into the biotech industry, which is the black line, but the amount of money per financing round is getting smaller and smaller. So the good old days when you could go to the stock market and say, give me a huge amount of money, I'm going to become Glaxo, are long, long gone. Okay. One of the reasons for that is the value of IPOs. So the exit you can get has gone down a lot. So now, if you want to make money in this industry, you'll be increasingly trying to get cash out of a trade sale. So you are not going to be able to get money from the stock markets, well, you might be. It'll be very difficult to get money from the stock markets to take your firm and grow it into a global firm. Instead, you are going to be getting a return for your investors by selling your projects to large pharma. So rather than competing with large pharma, you are becoming part of their supply chain. Make sense? Yeah? It's driven by the economics of the industry. Okay, this is potentially a worry because, how do I explain this? Given the different numbers of firms in the samples, we're comparing the expected with the observed, and we would expect to find certain amounts of stock market funding, and the production of drugs is the interesting black line. So you're comparing what we'd expect statistically and what we find in terms of what's the best way to go. If it is bigger, if the bottom bit of this is bigger, it is overperforming. If it's smaller, it's underperforming. Stock markets and VC are overperforming. VC only is underperforming quite significantly, and alternative forms aren't doing too badly. Okay, industrial structure. What's happening to the industry? Okay, this is a very, very interesting graph. If you're a geek like me who's interested in these things, you may think this is the most boring graph ever. Okay, what this graph is showing is it is showing a massive compression in the life cycle of biotech firms. So in the good old days, you get your average first VC investment after 6.2 years. You'd then go on and get an IPO after 12 years, and then after 20 years you'd be acquired. Okay, so you would grow a big firm through time, over a long period of time. If you look at the funding date cohort for the 2000s, there's a bit of issues about data here, but the rough picture is it's compressed to under 5 years. So you're not building big firms, you're building projects and selling projects. And your IPO is not an exit, your IPO is a round of funding. So the good old days of the 80s and 90s are long gone. Okay, is there a viable business model in which to make drugs here? Yes, there is. One of the issues constraining VC funding is that people are not convinced investing in VC is a good idea. And the reason they don't want to invest in VC is the returns are rubbish. So currently we exist in a time where if you give your investors a negative return, often they'll be quite happy. VC funds are even worse than that. The reason there's very little data on VC funds returns, it is commercial suicide for VC funds to publish the returns they give to investors. As a consequence, there has been a collapse of investment in VC funds, and currently in Europe, over half the money going into VC is coming from the state. So this is a very, very different picture from the kind of the good old days of the 80s. Okay, so the key business model that seems to be emerging in this area, which can get funding. So the old grower company, an IPO, it is not getting funding. This model is build a small company, very, very lean, and then sell the products and the projects that you have produced is funding. So this is Index Ventures, who have got a nice fat fund to do this. The green is a shift towards project-based small firms producing drugs, and they're moving out of the good old build a company up and IPO it. Okay, so key message. Traditional division of labour has been based on the idea that the public sector cannot manage complicated projects. These are very, very expensive. The Medical Research Council in the UK could probably fund 2 decent clinical trials. So you need to have industry people able to do this. So the public focuses on the basic research and the firms can manage the later stage. That early stage bit is becoming, because of the productivity crisis, very, very difficult. And that is causing a change in the industrial structure and a change in what biotech firms are doing. It is not clear that it is economically viable outside bits of the US. So the question is, if we want to produce drugs, what are we going to do about this? One option will be to fund from the taxpayer more early stage work and keep it longer to avoid the time cost of capital. And that requires a lot more money. It also runs the problem that scientists focus on, that's 10 minutes,
UK, you've got 12 actually.
I've got 2 minutes here. Scientists focus on producing academic papers, and they often do not understand the market and the commercial environment that will make these viable projects. So it is bringing into an earlier stage that commercial understanding, and one potential solution is spin-ins, which leads me to hand over to our next talker, who is an example of a spin-in academic who's come from industry to do this sort of work. Okay, thank you very much.
Thank you, Paul. Thank you for keeping to time. We'll keep to the same pattern as